A mass exodus of Nigerian medical professionals, care professionals and social workers may be looming. The United Kingdom, which halted visa issuance because of the pandemic, has announced a new health and care visa policy that could attract doctors, nurses and health workers in Nigeria and other countries to strengthen its national health service. The new visa policy aims to make it cheaper, quicker and easier for healthcare professionals to go to the UK beginning from August. Estimates have it that there are over 4,000 Nigerian doctors in the UK spread across 83 subspecialties. Nigeria's Minister of Health, Osage Hanire, has advised doctors seeking to relocate to reconsider, stating that the UK will not pay them hazard allowance. Joining us now from Benin on Skype is Dr. Osaho Enabulele. He is the President, Commonwealth Medical Association, and former President, Nigerian Medical Association, as well as the Chief Consultant, Family Physician at the University of Benin Teaching Hospital. Dr. Enabulele, it's good to have you join me on the program this morning.
Thank you very much.
Thank you. Yeah. Now, the idea or the issue of Nigerian doctors trooping out for greener pastures, either in the UK, in Canada, or in the United States, or anywhere in Europe for that matter. I know that is not new to you, but there has been a recent incident where so many doctors, about 58 doctors who intended to travel to the UK, were stopped by immigration officials. Talk to us basically about this, because Nigerians are really scared and concerned about this.
Yeah, it's quite unfortunate, but again, not unexpected. Not unexpected in the sense that we have always said that unless and until we put the right infrastructure in place, the right system in place, the right incentives in place, you're going to have a burgeoning increase, a burgeoning phenomenon of brain drain, unrestricted by whatever laws you put on grounds or whatever limitations you put on grounds. So what we are seeing is some level of desperation by those who ordinarily should be in our country to, of course, contribute. But because of the very poor conditions, poor working conditions in our country, they have no choice but to continue to exit our shores. Because, again, you have what we call pull factors from those economies and those countries, pulling them. Even in spite of the pandemic, people are still ready to vote with their legs to those countries. So I do not know why they had this kind of challenge. Was it political, was it diplomatic or whatever? Because I expected that a lot of these logistics ought to have been worked out. And the information I had was that there seemed to have been some level of, understanding between the British authorities and, of course, the Nigerian authorities. But how come it was at the point of departure that it was not suddenly realized that they said they had no visas, even when they had worked out arrangements, of course, to have their visas on arrival, which, of course, we know is usually done if you have that level of understanding and some level of bilateral agreement, in terms of your travel policies and all of that. But in terms of restricting movement, it's going to be very difficult. In fact, as I speak to you now, there are lots of Nigerian professionals who are still trying to look for means of exiting the country. And that is why we've been telling the Nigerian government over the years that unless and until you address what we call the push and the pull factors, the push factors in terms of those infrastructural issues, system issues, working conditions of your own professionals in your own country, you do not expect them to stay here because migration of labor is an international, phenomenon. It's an international issue. And so you cannot restrict them. It's a fundamental right to migrate to wherever they think they are better appreciated, better, able to practice their profession, which of course they have undergone in terms of the training and expertise for so many number of years. So you don't want to waste that kind of expertise in your own country, especially when you are not appreciated. I mean, another factor that has increased this is the lack of appreciation and commitment to the development, of course, and growth of the health professionals in our country. I mean, look at the whole clear case of the hazard allowance. It took even a strike action to even get the government to do what they promised to do in terms of increasing the amount of hazard allowance from the very miserable amount of 5,000 naira to what now was provided for as a COVID hazard allowance or incentive. Even that is not still being negotiated. It's still being pressured. They've only gotten 2 months of the promised 3 months, and nobody knows when the 3rd month is going to come. So when you even look at the pay disparity, when you look at the motivational, factors put on ground by those countries and economies, you may not be able to blame the health professionals who have taken a decision to vote with their feet to those countries.
All
I
right.
also need
Now,
to say
Dr.
that
Nabulele, let me interrupt you a little bit. You are the president of the Commonwealth Medical Association. There are so
absolutely.
many African countries who are members of the Commonwealth. Share with us what constructive and deliberate attempt you are having to engage with African leaders as a way of drawing attention to the welfare of doctors and the health sector as a whole.
Yeah, thank you very much. Just recently, we submitted again another reminder of our earlier proposals, for how to motivate and incentivize healthcare workers in the whole entire Commonwealth, not just in Africa, because it's not only in Africa that you have issues of health, workforce crisis. In fact, in Africa alone, unfortunately, Africa has most of the disease burden in the whole global space. Africa has about 24–25% of the disease burden of the world, but unfortunately has only about 3% of the global health workforce. So the challenge is more in Africa. But be that as it may, there are some other LMIC countries, the low and middle income countries, who are not necessarily African countries that still have this. So we have put all of this together and proposed to their various governments, and also to see how they can better incentivize their workers, because the critical aspect has to do with how you appreciate and motivate these workers. So whether in Uganda, whether in Zambia, whether in Zimbabwe, we are working even through the medical associations in those countries. Because again, we have our members represented as, professional and national medical associations in those various countries. So we act through them, giving them advice, giving them proposals, and a lot of them have been able to engage their governments. But unfortunately, only few have been able to respond even proactively and responsively to some of those proposals. So all we do now is to continually advocate, continually impress on them the need to even do much more to retain their health workers, to develop and retain their health workers, rather than allowing other developed economies to come and poach on their healthcare workforce and, of course, get them out. Because, again, those countries like Britain, for instance, are a bit more proactive. Even as developed as they are, they every day recognize their challenges and they look for solutions, very brilliant solutions to address those challenges. I mean, what could be more brilliant than the new health and care visa policy of the United Kingdom? I mean, you do not begrudge them, because they are doing their bit to see how they can attract the best of professionals from around the world, of course, highly skilled workers, to better their healthcare system. That is a government that thinks. That is a system that thrives. That is a system that is workable. So African governments must also buy into this, rather than the whole, the whole specter of, foreign medical tourism that they've all embarked on, with poor investments in the healthcare environment, with poor investments in the welfare and development of the health workforce. So clearly, we have been doing that for decades now, for years, and of course, we're still doing that as a Commonwealth Medical Association. But the unfortunate thing is that we do not see the kind of responsive approaches that we ought to be seeing in the African economies, in the African countries. And we have not given up on that. We'll continue to engage them. In fact, in the next 2 weeks, we're going to have a Commonwealth conference again to look at the health workforce, the challenges, the roles, expectations, and how we can better develop the health workforce in the entire Commonwealth. That we are arranging very soon, because we just had one webinar which was focused on the clinical case management of COVID-19. So we are moving now to look at the whole issue of the health workforce in the entire Commonwealth, with particular emphasis on those developing low, middle income countries, particularly in Africa, which have a lot of the health workforce challenge in the whole global community.
All right. Now, some experts say that the UK, the health and care visa policy which is prompted partially by the realities of COVID-19, is certainly to take care of the UK's health interest. Now, on the other hand, are you concerned that there could be implications to Nigeria could be on the receiving end of that kind of policy, especially when medical staff and all professionals begin to leave for the UK? Are you concerned what the consequence could be for Nigeria at the end of the day?
Of course, I'm concerned as a Nigerian, but again, I do not begrudge those countries who are putting in place very workable policies to attract the best of professionals. I mean, it's a global engagement. So every country has to put on ground, some pragmatic, proactive, and responsive strategies to attract the best of professionals for their healthcare system, especially if they really understand the essence of health system development in their various countries. I mean, the COVID pandemic has put it beyond any doubt that health is number one. Health is number one. Health remains number one, and health should be given the top priority that it deserves. So for those countries that have so committed themselves to that reality, then they will continue to put on ground the kind of policies and strategies that the UK government is just now employing. So you do not begrudge those countries. So I only expect that the Nigerian government will open our eyes to this reality and think further as to how to put on ground, not only cogitate, but this time as cogitate very pragmatic, proactive, and responsive strategies, especially those that have been so proposed over the years. Because what I always say is that the solutions are on ground in Nigeria. But the unfortunate thing is that we have not been able to commit ourselves to the implementation of the solutions. I mean, when I was president of the Nigerian Medical Association, there is nothing we did not do to canvass for a more, progressive, health workforce policy in our country. But every time you have workers having to struggle, having to pressure, and eventually even go on strike for things that ordinarily should be prepared by the Nigerian government. So I think the challenge is that of government, and not to make a statement as to suggest that because certain allowances are not paid in those countries, they should not go. That is not enough deterrent. That is not enough to limit those health workers from traveling. Because, like I said, there are what we call push factors, those factors that from the source countries are making workers to leave their economies, to leave their countries. And then the pull factors which prevail in the destination countries that attract those workers to come to their economies. So what is Nigerian government doing to, of course, moderate and, of course, manage those push factors? For instance, the issue of security. In fact, security more than anything now is a propelling factor for workers to leave the country.
Dr. Nabulele,
the issue of infrastructure, the issue
yes,
of training.
Dr. Sahoy Nabulele, we thank you so much for your insight and your concern, and we thank you for what you do as well. We look forward to greater days ahead for the Nigerian medical professionals as well as the health sector in Nigeria. We hope that your engagement will materialize for Nigerian health sector. Thank you very much for what you're doing.